In this module, we will discuss how to troubleshoot access-related issues. This is a vital component of patient training. Patients are taught how to troubleshoot common access-related issues and how to manage emergencies. Let us begin by reviewing how to overcome a fear of needling. Needle phobia can be a significant barrier to starting a patient on home hemodialysis. It is best to follow a stepwise approach. Patience and perseverance are encouraged by the home therapy team. Self-cannulation is a skill that takes time but can be mastered with practice. One person cannulating the access improves its longevity. Patients are the best at detecting an early sign of infiltration during self-cannulation. Let us now review some strategies to overcome fear of needles. The first step is teaching patients the basic anatomy of the access and how to examine by the look, listen, and feel approach. Aseptic precautions are reviewed and necessary. It is helpful if patients can observe cannulation at the home center or in-center unit. Next, they are encouraged to watch their own access getting cannulated. The observation time should get longer each cannulation. They are encouraged to compress the access site at the end of treatment. Getting the patients involved in small tasks every day, including holding and feeling needles, taping the needles, and applying local analgesic helps move the process to autonomy quicker. The home therapy nurse helps model cannulation by hand-holding approach. Next, let us discuss how to deal with needling pain. Applying warm compresses, topical anesthetic agent, and vapocoolant spray all have been shown to reduce pain at cannulation. Next, let us review strategies when dealing with a difficult cannulation. Patients are instructed to avoid flipping needles. Heparin locks or flushes are used to ensure patency of the access during temporary cannulation difficulties. They are taught to identify early signs of inflammation or infection at access site. If they are having difficulty cannulating the access, they can reposition the arm, change the angle, or slightly rotate the cannula. It is important to review flow rates and venous and arterial pressure to rule out stenosis or thrombosis. The home hemodialysis unit visit should be scheduled to review cannulation technique and evaluate the access site. Next, let us review bleeding complications of the AV access. Home hemodialysis patients are taught to identify early signs and to notify the home unit immediately if they notice blood spurting on inserting needles or prolonged bleeding time at end of session. It is important to review protocol for needle and tube taping to prevent accidental dislodgement. Wetness detectors and alarms are used under dialysis machine, dialyzer, and access arm to detect blood loss immediately. Patients are taught to examine access arm every day, compare both arms in the mirror, and follow closely for any changes in prior aneurysm, skin characteristics, necrosis, raised bumps after treatment, scabs that are not healing, or new pulsating mass. They are encouraged to rotate the site of cannulation. AV access hemorrhage can be life-threatening. Patients are taught to remain calm, apply firm pressure to site, raise hand overhead if possible, and call for emergency assistance. Application of towel is discouraged as it can pull more blood. Let us briefly review access infection. The goal is early cognition and treatment. Access infection can manifest as cellulitis, tunnel infection, exit site infection, or bacteremia. It is important to contact the home dialysis unit and arrange for blood and exit site cultures. Initially, broad-spectrum antibiotics are prescribed and then tapered based on antibiotic sensitivity results. An AV graft infection requires prolonged antibiotic coverage with possible graft excision. Next, let us discuss tunneled hemodialysis catheter care. It is important to always follow aseptic precautions. Scrub the hub protocol has been suggested to reduce catheter-associated infections. Use of wet alarms and wetness detectors are encouraged to detect blood leak. Catheter thrombosis management protocol, exit site prophylaxis, and showering protocol often varies with center. Medication-impregnated dressings are used for prevention of central venous catheter-related colonization and catheter-related bloodstream infections. Use of closed connector device is encouraged to decrease risk of unintentional disconnection, air embolism, and inadvertent bleeding. In short, good history and physical examination at monthly visit is key to picking up early signs of potential catastrophe. On each monthly visit, educate your patients and reinforce potential access-related issues. We have completed module on troubleshooting access-related issues.